Allison. I'm going to be your nurse today.
Hi, Allison.
All right. Can you tell me your name and date of birth?
Hannah Baker, and May of 1990, the 24th.
All right. That's correct. Nice to meet you, Miss Baker. Okay. What we're going to do today is a head-to-toe assessment. Is that okay?
Yes, ma'am.
All right. I'm going to start off by asking you some questions. All right. Can you tell me what today's date is?
17th of April.
Okay. Can you tell me why you're here today?
I'm here to get a checkup.
All right. And can you tell me who the President of the United States is?
Sure.
All right. The patient is learning oriented times 4. All right. I'm going to put on some blood examination gloves and take a look at you. All right.
Yes, ma'am.
All right. All right. I can see that the patient's head is nice and symmetrical. I'm going to feel in your hair, okay? All right. I don't feel any lumps, bumps, or masses. All right. The hair is symmetrical, equal thickness. Okay. I'm going to take a look in your eyes. Is that okay?
Yes, ma'am.
First, I want you to look at my pen, okay? Follow with your eyes and don't move your head. Okay, I'm going to shine a bright light in your eyes. The pupils are equally round, reactive to light and accommodation. I'm going to take a look in your ears, okay? Alright. The ears are symmetrical. I don't see any excess wax buildup or drainage. I'm going to look, if you tilt your head up, I'm going to look in your nose. Alright. The nares are patent. The mucous membranes are moist. And there is no drainage.
There should have been one up here. Because y'all been scanning them and ordering them one at the same time.
Alright. If you open your mouth up for me. Alright. The mucous membranes are nice and pink. I don't see any missing teeth. I don't see any wounds. Alright. And I'm just going to feel around your neck. Alright. The trachea is midline. I don't feel any growths or masses. Alright. I'm just going to check your pulse.
Hey, this is Matt on E4. I requested a couple
The carotid pulses are bounding at a +2.
I was going to see if they were ready. We just need a piece of
I'm going to... Okay. So now I'm going to just listen to your lungs, okay? If you'll sit up straight for me and take some deep in through your nose and out through your mouth.
Hey, Crystal, it's Matt on E4. I was looking for a couple phenylephrine drips for Maryland E404. I did message for him, yeah.
All right. The lung sounds are clear bilaterally. I don't hear any adventitious sounds. I'm going to also listen to your heart, okay? Okay. So I'm going to go aortic, pulmonic, Erb's point, tricuspid, and mitral. I'm going to listen there for a whole minute. Okay. Okay, patient's heart rate is 78. And then I'm gonna, if you'll lift your arm up for me, check range of motion. All right. I want you to pull back. All right.
Yes.
Patient has equal strength in both upper extremities, good range of motion. All right, then I'm going to listen to your bowel sounds, okay? All right, I've listened to the bowel sounds in all 4 quadrants of the abdomen. They are present. They are not hyperactive or hypoactive. I'm going to palpate your abdomen now, okay? Let me know if you feel any pain or tenderness. All right. I don't feel any masses, and the bladder is not distended. All right. If you'll sit up for me. Okay. I checked your carotid pulse. I'm going to go ahead and check your brachial pulse. The brachials are equal at a +2. Check your radial pulse. The radials are equal at a +2. I'm going to check your lower extremities. Will you extend your leg for me? All right. Can you flex your foot for me? All right, that's good. The other side, can you extend your leg? Flex your foot for me. All right. Patient has good range of motion bilaterally in the lower extremities. Let me ask you some questions about do you have regular bowel movements? You do? When's the last time that you had one?
This morning.
Okay, and it was regular? Okay. What about urine? Do you have pretty good urine output?
Yes, ma'am.
Okay, you don't notice any smells or discharge?
No.
All right, I would check the patient's femoral pulse. I'm going to also check the patient's popliteal pulses. They are equal bilaterally at a +2. I'm going to check the patient's dorsal pedis pulses, and they are equal at a +2 as well. All right, I'm going to ask you some questions. Is that okay?
Yes, ma'am.
First thing I want to do is something we call the CATS assessment. And so, do you have any problems or need assistance when bathing or getting dressed?
No, ma'am.
Okay. Do you have any toileting issues or problems with incontinence that you need
No, ma'am.
assistance with? Okay. I can see that you move well, so you have no problems getting up out of bed to the chair or anything like that, correct?
No, ma'am.
Do you have any issues feeding yourself or need assistance with that?
No, ma'am.
All right. So from the CAT assessment, I can determine that the patient is a 6 out of 6 and is highly independent. Next thing we're going to do is the spices assessment, okay? Do you have any issues with sleeping?
No, ma'am.
Okay. You stated before that you have no problems with eating, correct? And none with incontinence? Okay. Have you had any falls recently?
No, ma'am.
All right. Are you, and I did determine that you are alert and oriented, so there's no evidence of confusion. During my assessment, I observed no evidence of skin breakdown. Do you have any that you would like to report?
No, ma'am.
All right. Well, that is your spices assessment. We're going to also do one final assessment, and that is going to be your CAM. And so, from evaluating you, I determined there was no evidence of acute change in mental status. You did not have any issues with inattention. You didn't have any disorganized thinking, and you didn't have a altered level of consciousness. Are you having any issues with remembering things?
No, ma'am.
No issues with memory. Okay, and you haven't had any issues with agitation or being aggravated?
No, ma'am.
All right, and you said that you're sleeping pretty well?
Yes, ma'am.
All right, based on this assessment, I would say that this patient's mental status is not altered in any way. All right, thank you so much for letting me assess you today.
Thank you, ma'am.